Hello, everyone. Welcome to Friday. It's nice to see that it's Friday. I wish it was looking like it would be a little warmer this weekend. Take care of those plants if you've planted anything. We don't want to see those things freeze. And we're hearing from our meteorologist friends that it might be kind of cold. So still we're in May and we're grateful to be in May. So glad to be here with you today on Friday, May 8th. Jen Rumbalski from the La Crosse County Health Department. As always, I will start out with our case numbers and let you know where we're at for the state and for La Crosse County. At the state level, we have currently 9,590 positive test results. That is up 375 from yesterday. We also have a total of 97,265 negative results, and that is up 4,230 from yesterday. So when we look at the positive to the total number of tests over all of those, our percentage is 9% positive. And when we look at the percentage for just the from yesterday to today's tests, so the 375 positives over the total number of tests, it's 8.1% positive. So we're between an 8 and 9% positive rate or positive percentage. In addition to positive and negative results at the state level, we have 1,767 hospitalizations, and that is up 35 from yesterday and is 18%, meaning 18% of those that have COVID-19 require hospitalization. And we have 384 deaths, which is up 10 from yesterday. In La Crosse County, we continue to hold steady at 33. So I don't have any new cases for you today. We continue to have 26 that have recovered, and we have 2,588 total negative test results. I do want to acknowledge that we are currently at the state level that we know the Supreme Court is currently looking at the Safer at Home order and will rule very soon about whether or not they will keep that order in place or if they will overturn that order. So I just want you to know that we are aware of that. We are closely monitoring it, and we are planning and preparing for all contingencies as best as possible. I think, when we don't have control over certain aspects, including this order and what happens with it, it brings us back to what we do have. And what we do have is a strategy, and we have some data. So I'm going to share with you a little bit about that at this point. So first of all, I want to share, again, this strategy that we have been talking about in the past. So just as a reminder that we are really focused in on decreasing death and illness. That means the number of people who test positive for COVID-19 in La Crosse County. This includes areas of prevention with primary, secondary, and tertiary prevention. And the first one really, again, trying to do everything we can to prevent the spread, making sure that people do not get COVID-19 in the first place. So there are a number of things we do on this front to include education and messaging. And this is where, we continue to talk about, the behavior changes that across the nation we are all being asked to make, specifically including staying home and not congregating with others, hanging out within our households, and washing hands and wearing face coverings if we have to go out for essential travel. Area number 2 in our strategy is about identifying cases as early as possible and limiting the spread. So we know that anyone who comes down with COVID-19 and is diagnosed with that has had contact with others. Hopefully that's a very small number, but it can be large. And depending upon what happens with the order, if we end up having to open up faster than we're ready for, this is something we'll watch very carefully, because we want to try to minimize the number of individuals that we have to contact to say, we need you to quarantine or isolate yourself in order to prevent that spread. Because again, keeping people from getting it in the first place, and then finding it early and making sure no one else gets it is the best way to prevent the spread. And lastly, looking at those that might be diagnosed with COVID-19 and might develop severe symptoms, may require hospitalization, and this is where the deaths come in as well. We want to make sure that we are improving outcomes for those that do get sick with COVID-19. So we come back to this strategy as, sort of our foundation for what we do and how we prepare. Next, I want to show you, we have been pulling data in our county and also looking at data for other areas in our region to see where are we at with some of the metrics that the state has and maybe even some that the state doesn't have. So we're working on that now. And a couple of the things that I found, I think the area where we really are not ready is relating to the testing aspect. And so I want to show you here, in terms of new cases, when we look at the number of new cases across any jurisdiction, so here we're looking at La Crosse County in particular, and we're thinking about our objective here being that we want to decrease the number of cases. Here we're saying in our Hospital Emergency Readiness Consortium, that's what HERC means. Those are the counties around us. We want to decrease cases in this area as well as across the state, of course, but La Crosse County specifically. And we're looking at the metric here being that the percentage of change in new cases, comparing the total number of new cases in the most recent 2-week period with the total number of new cases in the prior 2-week period. So this we have to be careful with because our numbers are small and that can make percentages change quickly. But at this time, when we look at the overall goal that we would want to see more than a 10% decrease, we have actually seen an increase in La Crosse County. So do keep in mind, while this says 133% increase, that can be misleading. And I just want to clarify that that really means in the previous 2-week period, we had 3 new cases, and in the most recent 2-week period, it was 7. So when we look at those numbers, that's how we come up with this percentage. And so you can see that this says, based upon our new cases as laid out in this slide, we are not in a place where we would consider ourselves to be where we want to be in terms of this particular goal. Then I look also at the average daily number of tests that we're doing. So we talk a lot about testing, and that is because really it is not yet a reality where everyone who wants to be tested can get tested. We are still testing based upon priority areas. We are also working to make sure at this time that everyone who has symptoms can get tested. So we continue to hear about individuals that feel they have symptoms and aren't able to get tested. We really want to resolve that. So what we're looking at in this slide in particular, on the right-hand side of the slide, you see something called testing rates. And so that is a number that we take per 100,000 population. So if you look at the goal there, what we want to see is, and this is based upon what the state has set for a goal, so it's a 209 tests per 100,000 population. At the present point in this current 2-week period, we're at 54, and previously we were at 38. So we do have a ways to go to meet the goal. In addition, when you look at test averages, so the current average of daily tests in the most recent 2-week period is 63 tests per day on average. Previously, in the 2-week period before the current one, it was 45. So we have increased, which is really good. And that's what we wanted to see. Though I think we need to continue to increase because, as you can see in the goal at the bottom, the daily number of tests that we really want to have is about 247. So we are making some progress, but we're not there yet, as I think what the takeaway from these slides, I would want that to be. So as we think back to understanding that the Supreme Court is currently looking at and will very soon be ruling on the order at the state level, We don't have control over what happens with that order, but we do have the strategic plan, where we want to be and where we are based upon data. And we see that one of the areas where we continue to work on and have to improve in is testing. And so when we look at that, I do want to say that on Tuesday in the media briefing, I felt like we were still working towards ramping up in our healthcare partners. And while that continues to be the case, having conversations over this week with partners and understanding more what the data tells us, I think that we can use some help in that regard. And we are going to be having internal conversations about making an application to the National Guard for a testing site. So I want you to hear that based upon the data and our partners' communications, it makes sense to us that we would ask for a National Guard site to happen in La Crosse County. So we are going to be looking at and working on that application, and we will absolutely keep you informed about where that goes. So that process involves an application to the National Guard, and then there's a negotiation with the National Guard about all sorts of logistics and questions to include who can be tested, when will it happen, where will it be, and all of those details are yet to be worked out. And of course, will be dependent upon the National Guard approving the application that we make to them, which we anticipate would happen, but is really their decision to make. So the next item I want to bring up is that we have the Firefighters Credit Union is making a community challenge and will match up to $50,000 in cash donations for the food drive. It's just unbelievable to me. What a wonderful offer. So that will start next Monday on May 11th. And again, this is in relation to the food drive, and they will match up to $50,000 in cash donations. So that is a wonderful, positive challenge to our community and an amazing offer. So thank you to Firefighters Credit Union for that. Upcoming is I want you to be aware of that we have yet many college students in our community who will need to be moving out of their housing. So their leases are going to be up, and we anticipate that move out is coming soon. So I just wanted to plant the seed today to let you know that we're aware of that we're working on messaging. It's a pretty sort of comprehensive education and messaging piece that we're working on. But for all of you out there, I wanted you to just know that that event is not something that we can avoid. Those individuals need to move out of their locations. And so we're going to try to do our best to help make sure that that event is as safe as possible. But we do anticipate increased traffic during that time. And right now we're thinking that that's between May 15th and the 21st, I think are the dates. So again, we'll have more information about this next week, and of course in our Facebook messaging, so stay tuned for that. But with that increased traffic, we may also have increased individuals in local stores or doing carry out through local restaurants. So that is wonderful business to have, but also just wanting to make sure that we are aware that there will be additional individuals in our county to assist with those students moving out of their housing. A couple of reminders during that time for those that are doing move outs as well as others, just coming back to those same physical distancing, the 6 feet spacing between folks wherever possible. The fabric face coverings would be an important thing to use during those move out processes, and routine and regular hand washing. So there may be a peak of individuals in our community, and I wanted you all to be aware of that. And I again remind all of us that while all of these things are, important to decrease the spread of disease, this virus does not discriminate, and neither should we. So I want to reiterate that message with regards to this event that's coming up. Another thing that I had that just came out today that I wanted to let you know about is that there is a new resource specific to businesses on the Wisconsin Economic Development Corporation website. So that's wedc.org/reopen-guidelines. And we'll put that link up for you on our Facebook page. But there are guidelines that have just come out today that are specific to a number of sectors, including agriculture, construction, entertainment, gyms and fitness facilities, hair and nail salons, manufacturing, hospitality, lodging, and more. So please look at that website if that fits for you, and let us know if there's anything on that website that is still a gap for you that you need us to try to resolve. But I think that will be a really helpful resource for you. And they did, in the press release, put out some general advice, and that is for businesses, and that is to make sure that employees who are sick don't come to work, curtailing business travel wherever possible. And that takes me back to, I really believe that travel is a significant risk to our community in terms of where the virus is currently located. If we really have low levels of virus, which we don't know yet for sure until we do more testing, but we will increase the virus in our community with travel, particularly if that is to areas where the virus is more prevalent. So I think making sure business travel is reduced wherever possible, promoting telecommuting and other work from home arrangements, which many businesses are already working on, and making sure employees have access to sanitizers, hand washing, and personal protective equipment whenever possible. So then lastly, I just wanted to talk a little bit about, we are hearing that there is misinformation, maybe even some conspiracy theories, as well as some scams that may be out there. And we just want you to take caution with the information that you're looking at. So we encourage you wherever possible to find credible sources. We try to link things on our website and give you credible information. In addition, the Wisconsin Department of Health Services, the Centers for Disease Control, the World Health Organization would all be important sources of credible information for you to look at. We work really hard to be transparent, as you know, is a major value of mine and our departments. And we want to get you the information that you need. So if there is something that you question or that you need a resource on, we want to be that resource for you and help you find what you need. So I would just ask you again to utilize any of the same ways that you would have contacted us in the past, through Facebook, through our email address, which is covid19@lacrossecounty.org. And of course, on our hotline as well, which is 785-6240. So just give us a call, shoot us an email, ask us on Facebook, and we'll do our very best to try to respond to any questions that you have, to make sure that you have the information that is credible and can help you make good decisions. I think with that, I will take questions.
Hi, Jen. Marcus from News 19. I know things are always updating with this, but when we spoke last week about Buffalo County getting that National Guard testing, you said we were hoping that we wouldn't need one here in La Crosse County.
Yes.
So I'm wondering what changed.
Yeah, what changed really is, as I mentioned, the conversations that we had with our partners, including healthcare partners, as well as the data and really seeing what percentage we are testing, and the fact that while it's not bad, we think it could be better, and our residents deserve us bringing in a resource if there is one available to increase testing so that we have a better understanding of what's happening in our community. So I think for those reasons, we think it's important to make an application to the National Guard to have them come in for testing. Thank you for that question.
Jen, this is Caitlin with Wisdom News. You had talked about various information that's being put out there, and what I've been seeing a lot on social media is this plandemic documentary that people have been sharing. Any thoughts on that and the widespread beliefs on both ends when it comes to what's being revealed in this?
Yeah, so, again, I think people question the information that is shared, and there are individuals out there who do not trust government. I understand that. I happen to work for a local government entity, and because I do, I bring values of transparency and wanting to make sure that we share the most accurate information that we can. I get that there will be individuals who still don't trust that, and I can't change that, and I understand. However, I think we have to continue to encourage that we look at credible resources, and really there will always be with every very different kind of disease or new thing out there. I don't know that it really matters what it is. There will be distrust as to what to look at and what to believe. And I haven't reviewed that in detail, but I am aware of it. And I would just say it is not in alignment with what we know about this virus. And it really raises questions that are unnecessary to raise, in my opinion. I think people will believe what they want to believe, but we, again, work really hard to make sure that what we share is right, is fast, and is credible. And that's really important to us. It's a foundation of what we do here. I think many of our community residents know that, but I'll just reiterate. And I know that there is distrust, and I'm aware of that. And really, I would just ask you to look at the resources that we're providing you, because they are right and they are credible.
Jen, with the Supreme Court ruling probably coming soon, what outcome do you think is in the best interest for La Crosse County?
Marcus, you ask such good questions. What outcome? Well, while it is not going to be a popular response, I think that we are not ready for a full opening of our county and the state. I think we still have work to do. So I think an outcome where the order is overturned, particularly if there's no order in place to succeed it, would be very detrimental for our community, because it would open up significant risk to include travel and, the unknowns about where this virus really is. So I think that would be the worst outcome. I don't think that outcome will happen. I think that there will be some order in place, even if it isn't the safer at home order. But again, I think what we have to do is take control over what we have control, or where we can control. And I think about all of our great business partners out there who really are trying to do the right thing. This comes on an individual aspect, and it comes on a business aspect. It is all about knowing that we know what to do to be safe. We aren't ready for that to be widely open, but we have guidance materials that can help us do this safely and reduce the risk. I also want to say that, as I've talked about before, that there will be multiple peaks of this virus. And if we open too soon, we risk not coming out of the current peak that we're in, or ending up in another peak very quickly. So it is this delicate balance between being patient enough until we're ready and wanting to get back to at least some level of connectedness with others and local business revenue streams that are really critical for livelihood. But if we do that too soon and unsafely, we risk lives.
Caitlin again with Wisdom News. A question on our Facebook page. If and when these testing sites get set up with a National Guard, who determines people for testing, and will testing become mandatory?
So the two questions: who determines people for testing? So I think that's the criteria really for who would get tested. And would the testing become mandatory? No, I don't believe that the testing would become mandatory, at least not from a local government perspective. We do want to have individuals tested. We want them to have the availability, but we're not even close to being able to test as widely as anyone who wants to get tested can get tested, including people who are asymptomatic. We know that there are likely individuals in our communities that have the virus and don't know it because they don't have any symptoms, and then are able to spread that virus. We know that. But we aren't at a testing capacity, even with an application to the National Guard, where we could test people who don't have symptoms. So it is very likely that what we would ask the National Guard to consider, and again, they get to say yes or no to that, is we would ask them to consider for our application to test anyone who has symptoms, even if they are very mild. We would like to know and give the opportunity for anyone who has symptoms to be tested.
Hi, Jen. I saw the health department's Facebook page this morning was bringing awareness to the new contact tracing scam calls. I guess, what is some advice for somebody to know whether or not it is the health department or if it's someone calling to scam them?
You know, that is a very good question. And what I would tell you is that if you have any concern that you're not talking to the health department, you have every right, to ask them to verify that, and we will be ready to do that. So, we have a list of staff, and you can say, I'm going to call you back. Give me your number, and I'm going to send an email to the health department, and I'm going to say, I just got this call from somebody, and I want to know if they're from the health department or not. And we'll verify for you if they're from the health department. So if you feel unsafe and you need to do that, you can do that. But I think, the folks that we have that are calling you, hopefully you'll be able to recognize that, they know what they're talking about. They're going to call you up and give you, the reason that they're calling. They're going to tell you who they are and where they're from. They're going to tell you what they need to do on the phone call, and then they're going to walk you through that. So I think that, there is this gap where you might feel unsafe. And if you have a gut instinct that you don't feel safe with who's calling you, I'm totally fine if you ask that person to give their name and number, and you say, I'm going to call you back. Because oftentimes if it's a scam, if you do that, you're not going to get that person back. So I think you can either take their name and number and ask to call them back, or you can, take the name and number and send us an email or call our main number at the health department and say, is this legit? And we'll verify that for you.
Marcus from WXOW. Does anyone else have any other questions for Jen? Looks like we have Haley.
One more. Headed into the weekend, I know last Saturday was the day we saw that F grade. Weather's not predicted to be as nice, but what would the health department like to see for social distancing or any reminders headed into the weekend?
Yeah, thanks, Haley. Again, this is really tough, and I don't make these asks lightly. I really don't, because I'm following them myself, and it's really hard not being able to see family. But again, it is really staying with your household members. It is staying home unless you need to do essential travel to get essential items, groceries, things like that. And then it is wearing a face covering if you have to go out in public. And of course, it's always hand washing and covering your face, or I'm sorry, not touching your face. Those are really the best things. And then even if it is cold, we have to take care of ourselves as well. And I think, from a mental health aspect, making sure you touch base with people virtually, have calls where you can see them and talk to them as best you can. Write a letter to someone and send it in the mail. Make contact to satisfy the social needs that we have as humans. That's really important. And then also our physical and nutritional needs. Even if it's cold, get outside and get some fresh air, even for just a short time period. So I think those are all really good tips for you heading into the weekend to make sure that, we are doing what we need to do to continue to keep this virus out of our community as much as possible.
Any other questions for Jen today? I'm not seeing any.
Well, I just thank you all so much for tuning in, and I'm just so grateful to be a part of these with you, Tuesdays and Fridays. I really look forward to it. It's a nice connection, and I appreciate being able to share information, and hopefully that is helpful for you as well. I hope you have a wonderful weekend, and we will see you back here on Tuesday. Thank you, everyone.